Final quiz number 2. Number 1, a performance improvement training program has been conducted. The healthcare quality professionals has determined that improvement has not occurred. The most likely cause for the lack of improvement would be that A, organizational systems are inhibiting changes. B, employees practice what they are trained to do. C, staff members thought the program was too long. D, the facilitator did not prepare agenda materials. What's the answer, Radha? Doc Kulam? Anyone?
The
Okay. The answer here is letter A. Because these systemic barriers within the organization are often preventing the implementation of changes. When we say inhibiting, this one hinders, prevents. So even if training is already conducted, while the other options, the employees practice when they are trained to do, the staff members through programs too long, and the facilitator did not prepare agenda materials, are less likely causes, and employees practicing what they have learned. So this would lead to the improvement or program length for letter B. And for letter C, this might affect the engagement, but not outcomes. Okay, for the letter D, this would impact the session, but it will not give any results. For the correct answer is letter A. Organizational systems are inhibiting changes. Okay, number 2. Number 2, replacing retrospective. Replacing retrospective review with concurrent review is an example of a paradigm shift. B, process improvement. C, an empowerment process. D, productivity enhancement. What's your answer? Radha?
process improvement.
Okay, what's the answer here? So the answer here is letter
B.
A, paradigm shift. Okay, because replacing retrospective review with concurrent review, this represents a what? A fundamental change in approach. Mhm. So when we say this retrospective review, what does this mean? This is reviewing after the fact or after
The
patients
fact.
already discharged, with the concurrent review, which is the real-time monitoring of the patient. So this represents a fundamental change in approach, which means this shift moves from reactive to proactive processes. So the answer here is paradigm shift. Why not letter A? This also may lead to process improvements, but the change represents a broader fundamental transformation, not just an incremental improvement. So that's the reason. Why not letter C? Because this change, an empowerment process, this change is not directly about empowering individuals, but about modifying the review methodology. What about letter D? This might also improve as a result, but this is a secondary benefit only, not defining the characteristic of the change. The correct answer is paradigm shift. Number 3, which of the following best describe an organization's vision statement? A, it is used as marketing strategy. B, defines the structure of the institutions. Okay, C, it describes the organization's strategic plan. D, it reflects the organization's aspiration. What's
C.
your answer? Letter?
C.
Letter C, no. Okay, this is
Vision
not the
statement.
correct answer. Okay, give me another answer. Best. Which of the following is best describe an organization's vision statement? The answer here is letter.
Spirit.
Okay, yes, letter B. It
B.
reflects the organization's
Aspirate.
aspiration. Because a vision statement, okay, represents the organization's long-term aspirations and dreams, providing inspirations and a sense of purpose. Why not letter A? This is incorrect because a vision statement is not primarily a marketing tool. What about letter D? Letter B. This defines the institution's structure. Letter C. It is broader than a specific strategic plan. So the answer is letter B. Clear? Okay. Number 4. Quality improvement initiative progress is best evaluated by which of the following? A, team leaders, B, senior leadership, C, PDCA process, D, nominal group technique. What's your answer, Radha? Doc Gulam? Is Doc Gulam still here? Okay. So he left. Okay. So what's your answer, Radha?
PDCA process.
Very good. Yes, this is the correct answer because this provides a structured method to evaluate the improved quality initiatives systematically. While the other options like the team leader, the senior leadership, the nominal group technique, okay, these are may oversee, okay, or review the progress, but PDCA is the most effective evaluation framework. So, okay, number 5. Which of the following following element must be present in order to evaluate effectiveness of healthcare quality improvement program? What's the answer here? A, integrated data collection. B, quantified objectives. C, well-defined organization culture. D, well-educated medical staff.
Well-defined organization.
Very good. Yes, that's the correct answer. This is essential to evaluate the effectiveness of the healthcare quality improvement because this provides measurable goals or benchmarks that allow for the assessment of progress and success. Okay, why not letter A? This is also useful but not sufficient to evaluate the effectiveness without the specific or measurable objectives. Why not letter C? This one does not directly determine the evaluation of the program effectiveness. Well, also letter D, this is skilled staff are important for program implementation, but their presence does not guarantee a method for evaluating the effectiveness. Okay. Number 6, a team has identified a process for improvement, selected examples of best practice performers, visited those sites, gathered all necessary data, and compiled results. The most effective next step for the team is to A, identify the next process to benchmark, B, implement change back at the team site, C, compare results to historical data, D, make the results public for others to use in benchmarking. What's your answer, Radha? What's the answer here? A team has identified a process for improvement. So selected examples of best practice performers, visited those sites, gathered all necessary data, and compiled results. The most effective next step for the team is to what?
Identify the next process to benchmark.
No, to implement change back at the team's site. Why? Because after gathering and analyzing all data from the best practices, which is from the benchmark, the logical next step is to implement these changes at the team's own site, basing on the findings. Because
implement.
Okay. Because this ensures that the lessons learned from the best practices are applied to improve the identified process. Okay, this one also, because applying the findings is the next logical step after gathering all and analyzing the benchmarking data. So letter A here is wrong or incorrect because benchmarking is another process that should only occur after a successful implementing changes, right? And assessing the outcomes of the current improvement effort. For letter C, this is incorrect. Okay, this comparing the results may be useful for evaluation, but not the immediate next step for compiling benchmarking results. For letter D, this is also incorrect because sharing results may happen later, but the priority should be implementing the identified improvements internally. Okay, so in here, if you encounter the question in your exam, so what would be your answer here? So letter A, we have choice. Letter A, the first issue has not been resolved. It needs to be addressed before moving on to the next process. B, implementation is the next step in the performance improvement cycle. C, all necessary data have already been compiled. D, the process has not been completed, so there's nothing to share at this point. So what's your answer here?
Implement change.
Yes, implementation. Very good. So after all compiling all necessary data, the next step is, okay, in the performance improvement is to implement the identified changes. So this one is to address all the unresolved issues. Okay, next would be this for the compiling data or sharing results prematurely or secondary to taking action on the improvement plan. Clear, Radha? Okay. Next, number 7, the evaluation of the quality and appropriateness of patient care in the radiology department is the responsibility of the, okay, who? A, medical director of radiology. B, chief medical officer. C, medical director of the quality department. D, administrator of clinical services.
Radiology, medical director of radiology.
Yes, it's the medical director of radiology. So, medical director of a department has the chief responsibility for everything within that department. So, for letter B, the chief medical officer is responsible for the facility-wide medical staff operations. While for the director of the quality department is only for activities within the quality department. While letter D, the administrator of clinical services is responsible for the facility-wide clinical activities, while the medical director of radiology has what is this? Chief responsibility, direct responsibility, responsible for overseeing the quality and the appropriateness of patient care within the radiology department. Very good, Radha. Okay, number 8. All of the following can be utilized as measures of utilization performance except a number of encounters in outpatient clinic, B, ALOS in acute inpatient care or the average length of stay, C, denials of service, D, LIP's appraisal. Except. So what's the answer here?
Denials of service.
Okay. No. The answer here is letter D, LIP's appraisal. Because this refers
What is
to...
LIP? LIP.
The LIP stands for license.
Practitioners?
LIP stands for, wait, hold on. License.
Licensed practitioners.
Yes. Yes. This is the correct answer. Okay, because this one refers to evaluating the performance of individual healthcare providers, which is related to credentialing and competency assessment. So this is not directly to utilization performance. Okay, so for the number of encounters in outpatient clinic, this one is measures the volume of services provided, reflecting the utilization rates. For the ALOS, or the average length of stay, is a common utilization metric used to assess resources, efficiency, and care delivery. Why not denials of service? As you have answered.
Included in the measures of utilization.
Okay. Okay. What's your answer? About the denials? This one
No, I
is
said this is
deny.
again measures the utilization performance.
Okay. So this one, denials by insurance companies or other payers or an indicator of utilization programs. So this reflects issues with the authorization or the appropriateness of services. So the correct answer here is the LIP's appraisal or the licensed independent practitioners. Okay. So clear na, huh? So this is not a utilization performance. So number 9 is which of the following is not included in the organization plan? Letter A, evacuation plan. B, mission and vision statements. C, explanation of the governing board's responsibilities. D, scope and purpose. What's your answer?
C,
Letter C,
C.
which of the following not included? Careful to read the question carefully.
Scope and
Okay,
purpose.
because the keyword here is not included. So what's your answer? It would be what?
Organization plan, evacuation plan.
Yes, very good, Radha. Yes, the answer is evacuation plan. That's the answer. Okay. When we say organizational plan, this typically includes elements like the mission vision statement, the scope and purpose, and the governing board's responsibilities. So when we say this mission vision statement, this is incorrect. These are essential component of the organizational plan. For the letter C, explanation of the governing board's responsibilities is incorrect. Okay. So because the organizational plan typically outlines the roles and responsibilities of the governing board, as this is crucial for defining the leadership and decision-making process. Why not letter D, the scope and purpose? Because as they define the boundaries and objectives of the organization's operations and its reasons for existence. So this is incorrect. Okay. So the answer is evacuation, which is not included in the organization plan. Okay. Number 10, which of the following process is most cost-effective in preventing unnecessary resource consumption in the hospital? So letter A, effective pre-admission screening. B, accurate DRG assignment at admission. Second opinion for all surgeries, letter C. And pre-admission insurance benefit denials for letter D. Okay, what's your answer? What's your answer here?
Effective pre-admissions.
Effective pre-admission
DRG,
is...
assign. What is DRG?
DRG means the diagnosis-related group. It's a classification system used in healthcare to categorize patients into groups basing on their diagnosis, treatments, and other relevant factors. So the answer here is what letter?
B.
A, effective pre-admission screening. Yes. Okay. As you can see here, this is the most cost-effective way to prevent unnecessary resource consumption in hospital. So by assessing the appropriateness of admission and plan procedures beforehand, so hospital can avoid unnecessary hospitalizations, thus reducing any complications and optimizing the resource use. Okay, as you can see here, the effective pre-admission screening is the proper assessment of the patient. For letter B, this is wrong because to check the diagnosis-related group is to know the cost of the treatment, okay, which is part of the admission. So for this letter C, second opinions for all surgeries, this is to consider practice versus the guidelines. While letter D, this is incorrect because this is not related to the what is this? the preventing the unnecessary resource consumption. Okay. Clear, Radha?
Yes, yes.
Okay, number 11, utilization management assessments measures A, how practitioners utilize performance improvement data. B, the use of services, procedures, and facility resources. C, how employees utilize outcomes and manage daily responsibilities. And D, the use of high-risk equipment and the level of risk.
B,
Okay, when we say
the
utilization,
use of
meaning
services,
resources.
procedures, and facility resources.
Yes. Okay. So what's your answer? Letter?
B,
Letter B?
B.
Okay, very good. The use of services. So meaning utilization management assessments focus on evaluating how effectively and efficiently healthcare services, procedures, and facilities are being used. Okay, so for letter D, the use of high-risk equipment and the level of risk, this is a risk management. For letter A, this is incorrect because this relates to quality improvement efforts, not utilization management. For letter C, this is also incorrect because this pertains to workforce management. What for letter D, this is about the risk management. Okay, so we are clear for about this one. Number 12, which of the following is not relevant to include in both utilization management and quality management plans? What's your answer? A, confidentiality policy. B, process for appealing treatment denial. C, conflict of interest policy. The provision for annual program evaluation. What's your answer, Radha? Okay. What's
Both
your answer?
utilization and management plans.
Okay. The correct answer here is letter B. So here the keyword here is appealing.
B.
So this is applies to utilization management. Okay. So why letter A is not relevant? Okay.
It is quality plan.
Okay, the question is which of the following is not relevant to include in both? So meaning the A, confidentiality policy, conflict of interest policy, and provision are all relevant for the utilization management. Okay, so they are all included in the, or they are all relevant in utilization management and quality management plans. So letter B is the answer here, which is not relevant, which is the process for appealing treatment. Okay, denials. So which prioritizes the patient outcomes and service quality rather than administrative process. Okay, number 13. The primary purpose of an emergency preparedness program is to A, conduct evaluations of emergency training, B, provide evaluations of semi-annual evacuation drills, C, prevent internal disasters that disrupt the facility's ability to provide care and treatment, D, manage the consequences of disasters that disrupt the facility's ability to provide care. What's your answer here? Okay, letter?
D.
Okay, it's letter D. Okay, the answer here is letter D, manage the consequence of disasters that disrupt the facility ability to provide care. This is the primary goal of an emergency preparedness program, ensuring an effective disaster response. So for the other options like training, evaluations, or preventions are only secondary aspects. Okay, number 14. The healthcare risk manager is usually responsible for claims administration. So which of the following is included in this process? A, investigating, analyzing, and reporting. B, quality management, patient satisfaction surveys, and resource management. C, contracting, reporting, and resource management. D, patient satisfaction surveys, contracting, and investigation. What's your answer, Radha?
Yeah.
Very good. Okay. Because these are core. These three are the core task. Okay, core task of in claims administration. So ensuring incidents are properly managed. Well, for the other three, these are all unrelated tasks, like the patient satisfaction service or the resource management. Okay, number 15. Which of the following is not true regarding incident reporting? Okay, which is not true regarding incident reporting. So meaning the false statement and the other three are correct. A, it is a practical method of risk identification. What do you think? Is it true or false? It
It's
is.
true.
Yes, and incident reporting is a practical method of risk identification. Very good. What about letter B? It minimizes risk by reporting the incident close to the time of occurrence. Is it true or
True.
false? Hmm?
True.
True. Very good. What about letter C? It is the responsibility of any facility staff member who is part or has knowledge of the incident to report. Is it true or false?
True.
Yes, very good, because all staff members are responsible for reporting incidents. What about letter D? Reporting policy should be department specific. Is this true or
No.
false?
False.
False. So this is the answer. Letter D, because this is not true regarding incident report. Okay, very good, Radha. Because incident reporting is an organizational wide, not is the department specific. Okay, number 16, an integral part in the process of determining medical necessity in the delivery of quality medical care, including weighing the potential for undesirable outcomes and side effects against the potential for positive outcomes of a treatment, best describes letter A, cost effective medical care, B, efficacious medical care, C, efficient medical care, D, risk benefit analysis. Which one is true? Which one is correct? Hmm? Positive outcomes of a treatment. Keywords, positive outcomes of a treatment best
Effective.
describes.
Yes. Effective.
What's your answer? Letter?
Effective. Yes. Medical care. B or C. I don't know.
Okay, the correct answer here is cost effective
Most
medical
effective.
care. Yes, because
Oh,
it balances quality outcomes with financial
financial
efficiency.
perception.
When you see this cost effective all at all, this is about financial. Okay. So this addressing medical necessity within the broader framework. Okay, so this ensures also that the chosen treatment provides the best possible outcome for the patient. So while also considering the financial efficiency of the resources used. Okay, so that's the rationale. Why not letter B? This is incorrect because efficacious care evaluates the effectiveness of a treatment under ideal conditions, not the cost effectiveness or necessity in practice. Why not letter C? Because this pertains to achieving outcomes with minimal waste, but not directly addressing the balancing quality with cost. Well, letter D is incorrect also because this is a component of determining medical necessity. The cost effectiveness encompasses this within a broader framework of financial and clinical appropriateness. So again, cost effective medical care is something about the framework of financial and clinical appropriateness. Clear, Radha? Okay, number 17. Which of the following is the primary goal of risk management? Primary goal of risk management. Letter A, identify the high risk areas of the organization. B, maintain an effective incident reporting system. C, perform failure mode and effects analysis or FIMIA. D, reduce financial loss associated with legal actions. What's your answer?
Yes. Yeah.
Letter primary
Yeah.
goal of risk management. Mm. Reduce financial loss associated with illegal actions. This is the correct answer. So as you can see here in the slide, so how you will identify the higher risk areas of the organization is doing the risk management. We have the risk
Risk
identification.
identification.
We have to do the risk assessment. We have to do also the risk handling, and to have a to also to check the communication and evaluation. So the primary goal of the risk management is to what? Increase patient safety as always and reduce financial loss. Yes, primary goal always reduce financial loss associated with legal actions or increase patient safety.
Safety.
Yes. So clear, okay? Number 18, a utilization management department of a hospital has collected data on length of stay and readmission rates compared to benchmarks. The length of stay rates are higher and readmissions rate are lower. So which of the following is the next step? Okay, this is to identify the address and address the causes, okay? So this is about the identification and addressing the causes. What the statement is asking about. So we have choices here. Letter A, identify the additional benchmarks to compare the data. B, conduct a cost-benefit analysis. C, display readmission rates with a run chart. D, investigate the length of stay rates. What's your answer?
Conduct a cost-benefit analysis.
Okay. A utilization management department of hospital has collected data, already collected the length of stay and the readmission rates. So it was compared to benchmarks. So the length of stay rates are higher and readmission
Than
rates
the
are lower.
readmission.
So which of the following is the next step? So in here, the statement is for you to identify and to address the causes. So what you will do? What you think you will do? What's your answer? To
Benchmark again?
to
No. Investigate the length
investigate.
of
You
stay.
do investigation. Since the length of
Investigate.
stay rates is what? High, right? Then
Okay, so
benchmarks.
investigate the length of stay.
Yes, the next logical step here is to investigate the reasons behind the prolonged stay. For you, this can help to identify inefficiencies, any barriers to discharge, or unnecessary delays that need to be addressed. Okay, what was your answer? Letter A, this is incorrect because the existing benchmarks already indicate that the length of stay is an issue because the length of stay rates are higher. So further comparisons are necessary at this stage. Clear? For letter B,
Okay.
this is incorrect because this does not directly address the issue of the higher length of stay rates. So for letter C, this is incorrect also because readmission rates are already lower. Okay, so further analysis of the data is about the length, why there is a length of stay rates. Okay, clear? Okay, number 19. Case management is a comprehensive process that involves, okay, letter A, individual assessment. B, assessment of cohorts of similar patient groups, assessment of each DRG. D, assessment of the entire community. What's your answer?
The
Yes, Radha.
assessment of
What's your answer?
cohorts.
When we say cohorts, it is a group of individuals who share a common characteristics or experience with a defined time period. So this cohort is also used to describe a group of people studied over time to analyze outcomes or behaviors related to specific factors. So this is not the answer. Okay, this is not the answer. Again, the question is case management. Focuses on what? On
Comprehensive process.
on individual assessment. Okay, individual assessment. Because when we say assessment of cohorts of similar patients, this is related to disease management. And while for the letter D, assessment of the entire community, this is about a demand management. For individual assessment, case management is a personalized process that involves individual assessment to coordinate and optimize care for specific patients. It also focuses on evaluating each patient's needs, developing a tailored care plan, and ensuring efficient resource utilization. Your answer was assessment of cohorts is incorrect because this approach is more aligned with population health management. And as I said, it is a disease management. Assessment of each DRG. Okay, when we say DRG, what was the meaning? What is the meaning of DRG?
I
It
don't
is
know.
a diagnosis related group. This is incorrect because diagnosis related group assessments, this pertain to resource allocation and billing. So not a comprehensive care of individual patients. Letter D, assessment of the entire community. This is incorrect because this is pertains to demand management. Okay, clear? Clear, okay? Case management is comprehensive process that involves individual
Individual assessment.
assessment. Okay. Number 20, pre-authorization is required for all of the following, except, meaning there is one that is not correct answer, except. So what's the answer here? Letter A, inpatient acute care. B, ambulatory care. C, rehabilitation. D, psychiatric care. What's
Rehabilitation.
huh?
Rehabilitation.
No, this is not rehabilitation. Pre-authorization. When we say
This
pre-authorization,
required.
huh? What's your answer?
Yes. No,
When we say pre-authorization, Radha, this also known as prior, because pre means before. So prior authorization, this is a process required by insurance providers to approve specific medical treatments or procedures before they are provided. Okay, so which one here is not requiring a pre-authorization? Okay,
acute
when we
care.
say it is,
Inpatient acute care.
no, the answer is ambulatory care, which is the outpatient care department.
Outpatient
Okay.
care. Okay.
Because they don't, this refers to outpatient services and they don't need pre-authorization because these are our routine doctor's visit, minor procedures, diagnostic tests, or preventive care like vaccinations or checkups. Okay. The inpatient acute care, this requires pre-authorization. What do you think is the reason? What do you think is the reason, Radha? Because these ensure medical necessity and proper use of resources. And, hospital admissions are expensive and this involve significant resource use. For example, any surgeries or intensive care. And these insurers or the companies require the pre-authorization to confirm the necessity of hospitalization and ensure that less costly alternatives have been considered. Okay. While letter C, rehabilitation, this also requires pre-authorization. Why? Because to confirm the necessity and expected outcomes of the therapy. So services like physical therapy, the post-acute care. Okay, so this one, the resources is intensive and long-term. That is why it needs authorization. What about psychiatric? This is also pre-authorize because this helps the insurers confirm the diagnosis and the appropriateness of the treatment plan, avoiding unnecessary costs or services. So is it clear? That is the meaning of the pre-authorization. So all are except ambulatory care or our outpatient care department. Okay, to err is human. Crossing the quality chasm, who wrote this report? A, IHI, B, IOM, C, AHRQ. What's your answer?
IOM.
Very good. Yes, this is the correct answer. Okay. Any questions so far? Number 21, when analyzing complaints, the CPHQ would not A, report to the governing board the details of all complaints, B, establish a time frame for complaint resolution, C, review pertinent bylaws and regulations, D, categorize complaints by type, department, or area of concern. What's your answer? Okay, what's your answer? Letter? When we say governing body only receive summary, so not details. Okay, so this is the correct answer. Letter A. Okay, yes, because the CPHQ, okay, or the Certified Professional Healthcare Quality, focuses on analyzing and managing complaints effectively, but does not report individual complaints, all the complaints details to the governing board. So they don't report all the details. So instead, they typically provide the summary data, the trends, or aggregated analysis, to avoid overwhelming the board with individual case details and to focus on actionable insights. So that's the reason. Well, letter B, this is correct because timely resolution is critical, okay, in complaint management, and it is part of the CPHQ responsibilities. For letter C, this is also correct. Okay, because this ensures the complaints are handled in compliance with the organizational and legal requirements. For letter D, this is also correct. Categorizing the complaints helps identify the trends and areas for improvement. So letter A is the correct answer. The CPHQ would not report to the governing board the details of all complaints. Okay, so last is the deemed status means A, accreditation equivalency of meeting conditions of participation in Medicare and Medicaid programs. B, Centers for Medicare and Medicaid Services, or the CMS, accredited organization. What's the answer? Deemed status means deemed. Deemed status means yes. Yellow Radha. What's your answer? It's letter. Hello, Radha. Okay. The correct answer here is accreditation equivalency of meeting conditions of participation, Medicare and Medicaid programs. Okay, this deemed status means that the healthcare organization has been accredited by an approved accrediting body like the JCI. Okay, so it is recognized as meeting the conditions of the participation or the COPs set by the Medicare and Medicaid programs by eliminating the need for direct evaluation by the CMS as the accreditation is considered equivalent. So letter A is the correct answer. Okay, so that ends the quiz, final quiz number 2. Okay, any more question? So that ends now. So if none so far, so I'd like to end this lecture. Thank you for listening and thank you for your patience. So tomorrow will be about data analytics part 3 and final quiz number 3. So good evening, everyone, and wassalamu alaikum.